So a lot of times patients come in and they may have a very broken down dentition, a lot of cavities or decay, or sometimes they have a lot of wear on their teeth. So one of the ways we restore them is through a full mouth reconstruction, which is basically full mouth crown and bridge or full mouth of crowns. Sometimes that's combined with crown and bridge, sometimes that's also combined with implants. It starts off pretty much the same as if we're doing a cosmetic case. We still want to kind of figure out where the teeth are going to go in the smile frame. We want to figure out where the patient's jaw should be naturally positioned. So we want to make sure that the patient is comfortable when they're chewing and functioning, as well as when they're relaxed. So we try to make sure we measure the space between their jaws, similar to what we do with dentures. We also combine that with digital techniques, like digital smile design, to really kind of frame the teeth within the smile and within their face and give them the most natural and aesthetic result.